first of all, take a moment to welcome all of you to our RLE webinar. For those of you that are wondering about the benefits of refractive lens exchange, we're going to go through all of that today. I wanted to, Dean, give you an opportunity to just kind of introduce yourself, take your first few minutes, and kind of share your experience with our practice, and kind of just talk a little bit about your journey, please.
Well, thanks, Michael. Yeah, so I am the host of Home on KFI in LA, and which is a home improvement design and construction show that we do on the weekends, Saturday mornings and Sunday mornings. And I connected with Mark, Dr. Schneider, last year in conversations about, hey, getting the word out on RLE. And ended up going in to see him to see if I am in fact a candidate. Turns out I was a more than perfect candidate because I was in a situation where, just like everybody, you cross over that midline of your 40s, and your eyes, your close-up vision starts fading away. And it's annoying in my line of work, especially as a home designer and a builder. It's very, very annoying because I started having to kind of position glasses everywhere around me. There's glasses in the car, there's glasses, in the office, in the studio, and they're dirty, and then it's on and off, and where are they? And it just terrible. Anyway, contacts, never really a great solution for me either. Because of a condition in my right eye, was not a candidate for LASIK, and then of course learned from Mark that LASIK isn't even really something that it has long-term efficacy, as you get older anyway. It fades out quicker and quicker. So we had some serious conversations, and ended up pulling the trigger on RLE for my eyeballs, and we got around to doing it in April and started the process in April. And now I'm well over. I'm done. I'm signed off, and I honestly just am thrilled. I'm thrilled with everything. Obviously, I am thrilled with the final product here, which is that I think the last time I saw Dr. Sam, she signed me out and tested me off at combined vision of 2015. Which wow. Is better than when I was in my late 20s. And that's with and we had a very specific situation. I know, Mark, you're going to talk about the various kinds of lenses that were available. I had a very specific situation because of my right eye that we didn't go with a multifocal lens, but it's great. My brain has gotten used to it. It's seamless now, and I'm just loving life. It just feels like I've just got my vision back. I'm sitting here staring at a computer that's only 16 inches away from me. I see you guys crystal clear. I can look out the window. I can see the horizon crystal clear, and everything in between. So I'm thrilled. It was a series of procedures, all of them painless. Yeah. All of them complete. I mean, Dr. Sam is awesome. The whole staff is awesome. Everybody is awesome. I went through more eye tests in just the month leading up to having this done than I even knew existed or that I had ever done in my whole life. So talk about thorough, just knowing every nook and cranny, every inch and corner of my eyes and my vision. And, we're dialed in. I mean, I could not be happier.
Outstanding. I'm glad I'm recording this. This is an amazing sort of testimonial for the experience. Anything, Dean, I want to be respectful of your time while we have you. Anything you wanted to share about the actual procedure itself? What was that experience like for you?
It was fascinating. And one of the, I'm kind of fascinated by those things. I'm one of those people who wants to go in. I don't look away when I get a shot at the doctor's office, or with my many construction injuries that I've had over the year, they're like, well, you might want to just lay back as we stitch you up. I'm like, no, I would actually love to see it all happen. In this situation, you're working on my eyes. It's hard to see what's happening when your eye is being worked on, but I wanted to go through the whole situation. Now, it was interesting to me. It's a completely, I can't emphasize this enough, it's a completely painless experience. A little strange, when your vision is sort of in flux, but it's like a 15-minute process, and totally painless, even though they had me all set up, and I think so. Some people, and Dr. Mark will have to speak to this, but some people would rather kind of, it's like going to the dentist, right? Some people just sit there. It's like, hey, get the cleaning done. Other people want to kind of go off into dreamland. So you guys had me all set up for a little IV drip if I wanted to sort of sleep my way through it all, but I chose not to. I just want to experience it, and it was fascinating and absolutely as promised. There's no pain in the procedure, and it goes amazingly quick, and there's no pain in recovery, not for me at least. There were no issues. It just took a little time to get used to and heal up from the procedure. There she is. Hey, Dr. Sam. So yeah, it was, it's not something that happens to you every day, but it was a really, really super pleasant process. And talk about just having your hand held all the way through. And it's not just because I'm a spokesperson for, Schneider RLE on the radio, because I was in there with all sorts of other people having the same, I was in the same line with everybody else on surgery day. Everybody was getting treated the exact same way. And it was fantastic.
Oh, that's wonderful. Dr. Sam, welcome to the webinar. I wanted to, before we graciously, give Dean back the rest of his afternoon, I wanted to give you an opportunity to state anything at all about his specific procedure, or anything you'd like to share.
Yeah, I mean, Dean was a great patient, ideal patient. He was, like you said, kind of a special case. We did, the light adjustable lens for him. He had some very, specific requirements he wanted for near and up close. And, we were able to get him there. It took us a little bit of time, but I think ultimately he wound up with, the best possible vision we could get for him. And it seems like he's happy, so that's always our goal. But yeah, I mean, it was great, and we're, like he said, we're with you the whole way through, and we really want to get you the best possible vision for you, and that's a little bit different for everyone. And for Dean, this was the best way to go, and he wound up doing great. So
wonderful. Well, Dean, I want to thank you so much for taking some time to kind of chat with us. You're welcome to stay. You're welcome to drop off, but just thanks so much. And with that being said, I'm going to jump into the content. So Dean, thank you so much again. Really appreciate you.
Thank you, Dean.
Thanks, guys. You know what? I have about 5 minutes or so. I'm just going to hang out for a little bit, just in case somebody has another, what's it like to be a patient question. And then
and
drop out if that's okay.
Yeah. Perfect. And that's kind of the best next place for us to start is we're going to go into the actual content here. Bear with me as I get my slides up. But what I wanted to do is, there we go. Let me get this. I love Zoom. There we go. And there we are. Okay, awesome. All right. So what I want to kind of jump on in and talk through first is what's the outcome for you on this webinar. So today is not about deciding to have refractive lens exchange done. Today is about learning more about the procedure, learning about your eyes, learning about the journey that your vision and your eyes go on, especially after you pass that magical age of 40, 45, 50, and really helping to give you some certainty and clarity as to what's going on and what's possible, how you can potentially be able to see better at distance, up close, never need cataract surgery, all that kind of like amazing stuff. We're going to cover that here for you today. Now, the way that we're going to do the webinar is going to be done via Q&A style. So while we have Dean, if you do have any questions about his specific procedure, please feel free to punch that in into the Q&A little tab that you'll see on your Zoom bar. It says Q&A. That's where you're going to want to start putting some questions in. I see we already have a few questions in there. So what I'm going to do is I'm going to show you the specific questions, the most common questions that people have about the procedure, and then I'm going to take them down, and then Dr. Sam and Dr. Schneider, we're going to go through and literally just be able to kind of answer any questions that you've got. Dean, I can tell you that Brienne says, tell Dean it's nice to put a face to the KFI voice. So giving you a little bit of love from the peeps in the crowd here. So Dr. Schneider and Dr. Sam, I just want to give you both an opportunity to kind of just, welcome everybody and kind of speak a little bit about yourselves, if you will, and about our practice and experience, and also the obvious connection between the two of you. So, Dr. Schneider, how about you start off, please?
So yeah, I'd like to welcome everybody to learning about RLE, which out there in the world seems like a relatively new procedure, but really we've been doing this type of correction for a long time. It's just the technology has gotten to the point that now we feel very confident in offering it to people as a means of getting out of glasses and contacts, and also in, basically preventing cataract formation, because we take care of the cataract problem before it exists. But, also I'd like to just introduce my daughter, who I'm so proud that has joined us in the practice. And she's been kind of following in my footsteps since she was about 10 years old, when we took her on her first mission trip, and she's been going on them since. And it's just exciting to have her here and see what an amazing surgeon she's become.
Oh, wonderful. Dr. Sam, how do you follow that? But I'll give you an opportunity, please.
Yeah, I mean, hard to follow that, but I mean, I have big shoes to fill. It's an honor being able to work for and with my dad. Like you said, we've been doing this, I mean, together in some capacity or another for pretty much my whole life. So it's really awesome to be able to, have been able to learn from him and continue to learn from him. And it's really great to work together, and can't wait to, talk to all of you about this awesome procedure and how we can help you. I mean, that's our whole goal. That's our mission. That's what we live for. So
Lovely. With that in mind, let's get right into it. So again, we're going to go through, I'm going to show you the specific questions that we are going to be tackling on the webinar. I'll take the slides down so you can be able to see our faces and a little bit clearer. And then if you don't see your question in here, I'll be moderating the Q&A. So I'm going to blast through these real quick. We're going to talk about what is refractive lens exchange. Will I still need cataract surgery in the future if I have RLE? Can I have RLE if I have had LASIK in the past? It's a very common question. I already see we've had somebody's already asked that. We'll talk about the actual procedure, how long it takes, what sort of experience you will feel. Do you feel any pain during the actual procedure? Any side effects from the lenses? We'll talk about setting the right expectation for what you could be able to see distance and up close after the procedure, limitations on activities, pricing, of course. Is it covered by insurance? And then how do I know if I am a candidate? So I'm going to take down the slides. And Dr. Sam, I'm going to have you to tackle the first question, which is, let's talk about what is refractive lens exchange. But I think even prior to that, could we talk a little bit about the journey that the lens in the eye, like what are people experiencing right now? And just sort of from a patient's perspective, how that relates to refractive lens exchange. So it's kind of a 2-for-1, like what happens to the human eye as we age, and then where refractive lens exchange comes in and what it is, please.
Yeah, absolutely. So there are two major components to what we think of the eye and refraction or your prescription. One is the cornea, that's where we do LASIK. The other is the lens inside of your eye. So what happens is over time, that lens, its whole job basically is to change shape and to focus the light up close. Easy to do when we're young. As we hit our early 40s, that lens ages just like the rest of us. And it gets harder and harder for that lens to change shape and focus the light up close. That's what's called presbyopia. And that just continues to get worse over time. That's why you end up in readers and needing stronger and stronger prescription as the years go by. That's that lens aging. And so once you get into that age range, the best way to fix the prescription is, instead of working on the cornea like with LASIK, is we work on where the major problem is, and that's in the lens. So we actually remove that lens and we replace it with an artificial one that does the work for you and gets you seeing distance, intermediate, and up close without needing glasses.
Wonderful. Dr. Schneider, let's talk about, there's a couple questions here. So the first one is actually going to tackle it from people that have had, I can see Joyce asks if, am I a candidate since I had LASIK 20 years ago? I see another person asking, can you have RLE if you've had LASIK in the past? So let's talk about, for those people that may have had LASIK before, is this a procedure that they can consider, please?
Yeah, definitely. So we have several different options. And, really, what we do is during the evaluation, when you actually come into the office, we do an extensive testing. We look at the cornea, we look at the lens, we look at the back of the eye to make sure everything is healthy. And depending on what the cornea looks like, will help us decide which lens implant to use. But the easy answer is yes, most people can have some type of refractive lens exchange after LASIK. Really, the depending factor is what the cornea shape is, and then that's going to help us decide what lens implant to use. But the easy answer is yes, absolutely.
And Dr. Schneider, Brian asked a question because we talked about LASIK, but Brian asked, does RLE work for someone who, like me, had radial keratotomy eye surgery about 36 years ago?
Yes, it can, definitely. So for that person, typically what we would do is we would use something called the light adjustable lens, which is what Dean had. So someone who's had radial keratotomy, the cornea is pretty irregular. And so to mitigate any side effects of a multifocal lens, we'll put a lens inside the eye that we can actually adjust the power of that lens after surgery to really dial in what kind of prescription you want or where do you want to see. But yes, we definitely have done many people that have had radial keratotomy in the past.
Dr. Sam, the next question we're going to have you is to kind of paint the picture for somebody who they've found out they're a candidate. It's the day of the actual procedure. What can the experience, and then maybe kind of get in as much or as little detail as you'd like about, will they feel any pain, and just sort of what's the experience like after the procedure that day, and just let's give a little bit of a day in the life of an RLE patient, please.
Sure. So you come into our surgery center. We have a fully accredited surgery center that we have you come in here. You spend some time in pre-op dilating. That honestly is the longest part. We'll give you something to keep you nice and relaxed, and lots of numbing medication would dilate your eye. That takes about an hour or so. And then it's basically from there a two-step procedure. So the first step, we bring you into the laser room, and we use the laser to break up the lens. We use the laser to make a perfectly round opening in the front of that lens and to correct for any astigmatism that you might have. That takes about 2 minutes or so. From there, we bring you into the operating room, and that portion's about 10 minutes, 15 minutes. There's no pain. There's maybe a little bit of a pressure, you feel some liquid around the eye, but you shouldn't feel any pain. Dean can comment on this probably a little bit better than me. He's actually been through it. But at least that's in my experience, what my patients have told me. Then you go home that same day. You have a little shield on the eye, so you can see through it, but obviously things are a little bit fuzzy that afternoon. And then you shouldn't feel much pain afterwards either. Maybe a little bit of scratching, itching, feeling like you got something in the eye, a little bit of watering. That's all normal. But it's relatively simple. But maybe, I don't know, Dean, you have a minute or two, maybe you can comment on that from the patient's perspective.
Yeah, Dean, love to hear it.
Yeah, it was you're hearing the absolute truth about it. And by the way, it's funny because I don't know, doctors in general like to use the word pressure as a code word for pain, right? You go to the doctor and he's like, okay, you're going to feel a little pressure now. And then it's like, hey, that hurt. That wasn't pressure. But at Schneider, it's literally that. It really is. If the doctor says you're going to feel a little pressure, then it's just a little pressure. It's not pain. So you don't have to worry about it. It's not a synonym for pain. A little bit of pressure, that's all it is a little bit of pressure. I will tell you right now, the most uncomfortable part of the entire procedure, the whole thing, is that the first couple of eye drops of diluting, that makes your iris start to dilate. It stings a little bit, just a little, it's a little sting. That's literally it. I mean, once you're past being dilated and you're just sitting in this big, comfortable Barca-lounger chair while your eyes are dilating, and by the time you're done dilating and you actually go in for the procedure, you're literally past the worst of it, because it's just sitting there letting them do what they do. There's weird, funky lights, that happens when light is going into your eyeball and you're in between lenses at the moment, but there is no pain. It is a pain. And like I said, they also, have everybody like ready, kind of IV ready, if you want. There's an anesthesiologist standing by if you want to kind of just mellow out and not. Some people are just emotionally uncomfortable with that. I mean, some people are emotionally uncomfortable with getting their teeth cleaned. It's literally kind of the same. There you go, the same kind of situation. And like I said, I wanted to experience the whole thing. And you know, you have the procedure done on each eye. So after I had the first eye done, and then we waited a week for the second eye. Believe me, if there had been discomfort or pain, I would have went in for eye 2 and said, okay, I've lived through the whole thing. Now you can give me, you know, now fade me away. But there was just no need. It was really cool. And as far as healing up is concerned, my left eye, which is the obedient eye in my head, had zero. I mean, I had zero. None of the things that Dr. Sam said could happen happened. Zero things. Just it was just like, all right. 15 minutes after we were done, it just felt like it always does. My right eye, when I had that one done, was a little more ornery, but not like pain or headaches or anything like that. Just a little bit, a little scratchy, just for a very short period of time. So that was my experience. It is I mean, considering what it is that you're having done, considering that you are saying goodbye to all of this other stuff and you're actually getting your vision back, this is just, I mean, the joy of that happening carries you through, you know, everything, and the whole experience inpatient and out is very pleasant, very smooth, very pleasant.
Wonderful. Dr. Schneider, you get the next question, which is from Carrie asking, how long do the lenses last? I had LASIK and it only lasted a few years. Then I need to have glasses again. I have an astigmatism. And so just let's talk a bit about how long the lenses last, and then also just anything you'd like to say about astigmatism as well, please.
So the lens implant is typically made out of acrylic or silicone material, and it basically lasts forever. So what happens is, as our eyes are aging, the vast majority of the changes that occur in the lens. So typically when the eyes change after LASIK, it's not because the cornea changed or the LASIK stopped working. It's because the lens on the inside of the eye changed shape or lost its ability to function. And that's what causes the vision to change after LASIK. So when we remove that dysfunctional lens that's not working anymore and replace it with an artificial lens that's good forever, basically, then typically the eyes don't change anymore. It's very rare. Or if there's something changes, it's very subtle typically, and we can easily adjust with the LASIK again if need be. But again, those lenses last forever. I mean, we've been putting in these type of lenses for 30, 40 years, and they do not go bad ever.
Excellent. Dr. Sam, I'm going to have you to answer this one, which is it possible to have RLE if I have macular degeneration? Terry asked that question, please.
So potentially, you know, our goal is to get your eye seeing the best that your eye is capable of seeing. If you have underlying eye conditions like glaucoma or macular degeneration, macular holes or pucker or something like that, it is still possible for us to do a refractive lens exchange. However, the vision afterwards can only be as good as the eye itself, you know, can see. So with those underlying conditions, we have that caveat. Some lenses work better in those conditions versus others. So we are somewhat limited in terms of, you know, our options, but we still can optimize the vision in patients that have other things going on.
Great. Dr. Schneider, we've got a couple questions here from Barbara, one from Maria, which is, what are the post-op restrictions and for how long? And then Maria asked, what are the follow-up requirements after the procedure? So they've had the procedure done. What is the coming days and weeks afterwards as with respect to visits in the practice and restrictions on any activities, please?
So typically, you come in the day of the procedure. We see you the next day just to make sure everything is good. Then we'll see you a week later, and then usually about a month later. That's the typical course. But if you're getting a light adjustable lens, the follow-up is a little bit different because we adjust the lens over time. That requires more frequent visits. Typically After a month, we'll see you monthly until the lens is adjusted to how you want it to see. And then we lock it into place and then you're good. As far as the restrictions, we don't want you doing any heavy lifting for a week or two. We don't want you going, submerging in water, swimming, that type of thing. We want water out of the eye for at least a week or so. And then there's some eye drops to put in, typically for about 3 weeks. We use antibiotic and anti-inflammatory drops. But other than that, most people after RLE are seeing well enough to function the next day. Most people can go to work the next day. If you have a day type job, if you're doing a job that requires some type of construction or in a lot of dust, we ask you to take a couple days off. But most people are going back to work the next day.
Dr. Sam, I've got 2 for 1 here with respect to they've had the procedure done. Anything with respect to short-term side effects that a patient needs to consider? And we've got Deanne asks any issue with dry eyes, and then Rita asks, will my eyes be sensitive to light for the rest of their lives as after I have this procedure? So anything that a person needs to be aware of short-term, long-term after RLE with respect to side effects, please.
So short term, it's pretty common to have a little bit of light sensitivity for the first couple days, sometimes first few weeks. And again, it's very common to have a little bit of foreign body sensation, like the eyes are dry or a little scratchy, a little bit irritated. And again, that varies from person to person. That can last for a month or 2, but we always start everybody on artificial tears to kind of help prevent a little bit of that and to get you back to baseline much sooner. But those feelings are normal as you're healing. If you have underlying dry eye before surgery, that can get exacerbated a little bit in the early post-op period for the first month or 2. But again, you get back to baseline and hopefully even better after that, especially if you're wearing contacts. So once we get you out of the contacts, a lot of times those issues can get better in the long run.
Dr. Schneider, I've got a question for you here, which is maybe this is a good segue to talking about the lens options that are available, because somebody asks, how are these lenses different than those that are used during the cataract procedure? So maybe we could talk a little bit about the lenses and answer that question as you see fit.
So we actually do use the same type of lenses that in cataract surgery. And what we do is, as far as picking the type or style of lens we use, that's where the consultation and one-to-one discussion is really important, because we don't just randomly pick a lens. We want to customize the lens type to the type of vision you want and the lifestyle you want. Some people want to see better up close. Some people want to see better far away. Some people have different vision requirements, and we'll kind of adjust the lens based on what we see in your eye exam and what your goals are. But very similar lens. But when there's basically 2 types of cataract surgery, and we call it traditional cataract surgery. And that cataract surgery basically removes the dense or cataract lens and replaces it with a standard lens implant, but it doesn't correct the vision. It takes the cataract out, but the person will still use glasses, usually both for distance and near. And we have refractive cataract surgery. Refractive cataract surgery and an RLE is the exact same thing. Basically, we're customizing the outcome to how you want to see, and we use the same lenses that we use in RLE. And that's, that gets into the whole thing of when you have an RLE, you never need cataract surgery in the future, because that dysfunctional or abnormal lens is now gone. You never need to have that done.
Dr. Sam, anything you wanted to add to that? I think that's a very important distinction for people to understand, is that having RLE today means that you will never get a cataract or need cataract surgery in the future. Anything you'd like to add, please?
Yeah, I mean, I think that's one of the benefits that we see, is that a lot of our patients talk about why am I going to wait until my vision gets so bad? I'd like to enjoy my vision now. So that's one of the benefits of doing the RLE versus waiting until you have a cataract. You could absolutely wait, but you get the benefit of enjoying 5, 10, 15 more years of good vision without glasses, and then you never get a cataract. So, that's one thing, is that doing it a little bit earlier, you get that longevity out of your vision. The surgery tends to be quicker, you heal better, faster. So all of those are benefits, as well as never needing cataract surgery.
Dr. Schneider, I've got a question here from Clem, which is talking a little bit more on the LASIK side about, because a lot of people may have heard that, well, you can do monovision LASIK or for your procedure, or blended vision as he referred. So what would be, I guess, the best age for someone to consider monovision that maybe isn't quite ready for RLE, but just maybe talk about that a little bit, about the difference between monovision and refractive lens exchange, please.
So, it really depends on what the lens looks like in the eye and the age of the patient. I mean, absolutely, we do a lot of blended vision or monovision LASIK on people in their late 40s, 50s, and beyond. The biggest disadvantage, and what I always like to touch on when someone, especially in their 60s, comes in and says, I want LASIK, I want blended vision LASIK. Can you do it? Yeah, we can do it, but it's not going to last as long as if someone who had it in their 20s. So someone who had it in their 20s, they have from age 20 to their mid 40s of glasses, freedom from glasses for far and near vision. If we do LASIK on you in your 60s, well, that lens is going to continue to deteriorate, usually at a faster rate. And so maybe you'll get 5 to 10 years out of it, and then we have to do cataract surgery anyway. So it just kind of depends on, again, the person's goal. If they say, I never want to have another surgery again, well, then RLE is the way to go. If they say, well, I just want LASIK for now and I'll do the RLE later, they can do that. And that still is an option. If we do LASIK now, they could still have RLE, done when they get a cataract if they want.
Dr. Sam, we've got a question here. Two people have asked us.
Michael?
Oh yeah, please. Dean, go
I
ahead.
just wanted to say bye to everybody. I gotta bail on you.
Thanks, Dean.
Dr. Mark, Dr. Sam, great seeing you guys. Great seeing you very clearly.
Oh, I love it.
Just to everybody, thanks for being on the webinar. And let me just tell you, it is worth every moment of investigation. Ask every question and get into the office and let them check you out. You're gonna be thrilled. You're gonna walk away, bare minimum, knowing more about your eyes than anyone has ever told you before. And that's a whole level of confidence right there. So I'll see you guys. Thanks a lot.
Thanks,
Michael.
Bye.
Great, thank you. Dr. Sam wanted to give you an opportunity to answer this one from Barbara. So Barbara asks, is one eye done at a time? Carl asks, both eyes done same day. So just what can they expect as far as, is it one per day? Is it both the same day? What is that like?
So we like to do one eye at a time. We'll typically separate you by about a week. So one eye, 1 week, the other eye the next week. And that's really for two reasons. One is that the biggest unknown is how you're going to heal. Everybody heals a little bit differently. So we like to make sure you do well with the first eye before we go to do the second eye. The second is that if we need to make any minor adjustments, or we're deciding between one lens versus the other, we can see how you are adjusting, how you like the lens that we placed in the first eye before we make that final decision for the second eye. So there's really a couple benefits to waiting, and that's sort of what we've seen. We have good results with that.
Dr. Schneider, Gina asks, what does it mean when the doctors say that once the procedure is done, that there may need to do an adjustment? What exactly does that entail? So I think there's probably two different adjustments we can talk through. One of which is if there needs to be a LASIK touch-up, and then I guess the other side is the light adjustable lens, the adjustments that can do. So I know there's a little bit wrapped up in that answer, but what are your thoughts?
So one of the biggest determining factors of what the postoperative refraction or need for glasses is going to be is something called the effective lens position. And we do a number of calculations preoperatively to determine where that lens is going to sit in your eye. But again, the wild card is how you heal as an individual. So what happens is sometimes as that lens becomes a permanent fixture in your eye, the lens can shift either forward or backwards a fraction of a millimeter. Well, and if that occurs, it's like taking your pair of glasses and getting a telescopic effect. It's going to definitely change the prescription. And maybe about 5 to 10% of people that occurs. And so when that happens, we just bring you in and do a LASIK touch-up to fine-tune the vision, and then the eye doesn't change anymore. We typically will wait a month or two, making sure everything is settled and not going to change. So then we do that touch-up. And then to address the light adjustable lens, again, basically what we're doing with that is we're overcoming the need to go back in and do a LASIK adjustment. So it's a non-surgical adjustment of the eye that we use a special light device that the lens has the substance called a macumer inside the lens, and that we use a special ultraviolet light delivery system to change the shape of the lens and fine tune the vision without actually touching the eye. And that occurs, over a couple month period, and then we lock it into place, and then the eyes don't change anymore.
Dr. Sam, just to piggyback off of that, let's talk about this question from Sharon, which is, what is an average time for the brain to adjust to processing with new vision? So they've had the procedure done. What is that experience like, and how long it takes somebody typically to kind of lock in and feel like they've got their vision where they want to have it?
Yeah, so I'd say most people can see on the eye chart, very well within the first day to week. But that adjustment is really what takes the longest. Everybody's a little bit different, but we find it's really the first 3 to 6 months where your brain is fully adapting and fully getting used to your whole new eyes and whole new visual system. So it can take up to 6 months for you to fully adjust. Now, during that adjustment period, you can see up close, you can see far away, but it's really just kind of retraining your brain and learning how things are working. So we say anywhere from 3 to 6 months is that adaptation period. Some people are much faster than that. Others take a little bit longer, but that's pretty average, 3 to 6 months.
Great. Monica, can you share the video when done? I'm at work and can't quite listen, but I'm interested in information and wanted to know if this is covered by insurance. Absolutely. Everyone that is registered for the webinar will receive a copy of the actual webinar itself. I'm going to go through a few more questions and we'll go into pricing, because I think that's a common question people will have. Dr. Schneider, the question here is, what if you have floaters? Will RLE remove them? What's your thoughts on that?
So RLE will not specifically do anything to the floaters, but as kind of a side effect, what can happen is that when we remove the lens of the eye, the human lens of the eye, and replace it with the artificial lens, the normal human lens is about 5 millimeters in thickness, and the new lens is about 1 millimeter in thickness. So what will happen is the vitreous gel, which is in the back of the eye, will shift forward to fill that void. And what can happen in that is that the floaters can then settle down into the bottom of the vision. Although sometimes people get more floaters after it, but it's really not to adjust the floaters at all. They can usually get better, but they sometimes can get worse. Rare, but can happen.
Dr. Sam, I've got a couple questions here just to kind of revisit activities after the procedure. Rob asks, does any form of exercise impact recovery? How long before I can return to martial arts practice? And I had another question regarding weight training. So just kind of circle back in on that and timelines, please.
Yeah. So for the first week or two, like we mentioned, we really don't want you bending over too far or lifting anything too heavy, more than 10 or 15 pounds. The reason for that is we don't use any stitches or anything like that. And so we really want to keep everything where it's supposed to be. But you can walk, you can do stuff like that. I just don't want any real vigorous physical activity for maybe the first 1 to 2 weeks after surgery. After that, you can get back to whatever you were doing before.
Dr. Schneider, Dana asks, will I need reading glasses again down the line? Thoughts?
No, that's the whole point. I mean, the whole idea of the RLE is to make you free from glasses for the rest of your life. I mean, that's our goal. So no.
Nice. Dr. Sam, Dustin asks, for the light adjustable lens for a refractive lens exchange, what are the odds of a serious negative outcome such as blindness? If we think about it, anytime somebody is considering a procedure for your eye, we understand that there's a natural trepidation and anxiety about that. So let's tackle that question. What comments would you have for Dustin and anyone else, please?
Yeah, absolutely. So, obviously, anytime we do surgery, risks are something we need to talk about. Risks and benefits are an important part of the conversation. The risk of any serious complication, blindness, serious infection, anything like that is exceedingly small, less than 0.01% of the time. It's very small, but that obviously is a consideration. That's why we have some of those restrictions in place. That's why we do what we do in terms of having you on antibiotics. We take all the precautions during surgery to prevent anything like that. So even though the risk is exceedingly small, it is something that you need to be aware of before you go into something like this. Absolutely. So that's a great question.
Okay.
You know, I'd like to also add that it's kind of important where you have this done. And we perform all of our surgery in a AAAHC certified surgery center, which means that it has all the sterile requirements of a hospital, which we feel it makes it much safer than like doing it in the office. So we follow very strict guidelines for sterility. We use that dedicated space only for eye surgery and nothing else. So I think that's extremely important.
I'm going to tackle the next question, which is with respect to pricing and insurance and all that. So refractive lens exchange is an elective procedure. And so if you think about it, it's very similar to cataract surgery, except you're having it done earlier in your life before medically speaking, you need to have a cataract. And so that you get to have the benefits today of clear vision, but unfortunately, it's not typically covered by insurance. With respect to pricing, the actual lenses, there's a slight variance in pricing, but it's between $6,000 per eye to $6,500 per eye. The $6,500 per eye is for the light adjustable lens. And we do have exceptional financing options to which we can kind of make it a bit more palatable on a monthly basis for you to be able to afford. The next step, for those of you that are here on the webinar, and I want to be, we're going to continue answering all questions, but I wanted just to make sure that I gave you an opportunity to know what the next step is. And so the next step is really to have a conversation. And that conversation, what we do is we do it virtually. So you're able to do it very similar to what we're doing right now on Zoom, except we'll connect with you face to face and answer any and all remaining questions that you've got. And so that's the next step for you. And then after we have that conversation, kind of find out where your eyes are at, where your vision's at. Then what we'd like to do is then we'll extend you an invitation to come into our practice. We'll do all the medical, the examination to make sure that medically speaking, you're an excellent candidate. So just a short Zoom chat just to kind of find out where your vision's at. And you can be able to schedule that on SchneiderLASIK.com. That's kind of we extend it out to everyone here to be able to kind of do that. So Dr. Schneider, anything you wanted to add with respect to, for somebody who asks, is RLE covered by my insurance, or if there's a possibility of it, anything you wanted to add there, please?
No, I mean, our experience has been pretty much that it's not covered by insurance. But the one thing to think about is that refractive cataract surgery is not covered by insurance either.
Yes.
So typically what happens, if you wait until you have a cataract, then the upgrade to the refractive lens and the laser procedure is not covered by insurance anyway. And so I think that's an important thing to think about.
One quick follow-up from Brianne here, which is, what about FSA or HSA accounts? Can this procedure, can they use those dollars for this procedure?
Yeah, absolutely.
Awesome. Thank you, Brianne, for asking that question. Okay. A couple other ones, and I know we like to kind of keep these to 45, 50 minutes. I've got a few other ones here. One from Deanne, which asks, why does it look like a diamond flashing after it's done? Does this have to do with a specific lens? I'm not entirely sure exactly what that is, but maybe Dr. Sam, anything that kind of speaks to you about that question you want to answer?
So I'm not sure if you mean while looking at somebody else's eye that's had it done, or
maybe it's when the procedure is being done, is they're seeing any sort of flashing during the actual procedure?
Yeah, I mean, it does look like a light show when you're getting the procedure done. I've heard LSD trip. I've heard all sorts of things during the procedure. So there is kind of a funky light show. Afterwards, with some of the older lenses that we used to use, people will say you get a little twinkle in the eye. So maybe that's what they were talking about. I'm not sure.
That's totally fine. Two other remaining questions I've got here. One from Barbara. During the brain adjustment, would it potentially cause any dizziness or fall risks? Dr. Sam, thoughts?
Should not have any issues with dizziness or fall risks. We've actually done some studies on these multifocal lenses showing that they decrease fall risks actually in our older cataract population. So there is some benefits to decreasing fall risks. Dizziness usually is not an issue. We kind of have a sweet spot that if you're going for a blended vision or LAL with the adjustments, that really minimizes any of those. So shouldn't have any issues with that.
Dr. Schneider, I know we've touched on this a little bit, but I want to make sure we answer Sharon's question. Will the procedure affect sensitivity to light reflection when driving at night? I know we talked about that earlier, but any other comments, please?
So, as we mentioned, initially, most people are a little bit sensitive to the light for a few days to a week or so. And some people do have issues with night driving. That could be one of the side effects that we see with some of the lens implants that we use. But the vast majority of people, the brain will adjust to that. That's part of the adaptation period. And if someone is really concerned about that occurring, then we pick a different type of lens. We have options. What we pick for someone who drives a truck at night across the country, lens type may be different than someone who doesn't drive at night at all and just likes to read a lot. So again, it's all about customization to the person's life. I mean, that's why, I think it's so important that you have a discussion with the doctor and they know what you want, because if we don't know what you want, we can't customize it to you. So that's super important.
Dr. Sam, question for you with respect to astigmatism. So can astigmatism be treated with RLE? But maybe let's just back up and talk about what exactly is astigmatism, and then we can answer the second part. Is it treatable with RLE, please?
Sure. So astigmatism is very common. It's basically the shape of the eye. So what we say is normal is like a basketball shape. Granted, about 70% of people have astigmatism. So I guess normal is really the football shape, and that's what astigmatism is. We correct for that at the time of surgery, either with the laser or a specialty lens implant that corrects the astigmatism, depending on how much you have.
Excellent. Okay, and then Rita asked, what about double astigmatism?
What?
Not sure what double astigmatism what we're referring to.
Not sure either, but I'd love to figure it out. Come on in. Let's figure it out.
Yeah, and I think that's a great. I'm seeing a lot of questions people are having about, hey, can I have RLE if I've had XYZ issue with my eyes? The best answer that we can be able to provide to you is to have yourself a initial consultation with us, and we will go through all the exhaustive testing and measurements to really make sure that you are a good candidate. So rest assured, we will never do a procedure unless someone's an exceptional candidate for the actual procedure itself. I'm going to put this up right here. I know that here, I'll just take that down. I had the actual slide for people to be able to see. If you wanted to find out if you are a candidate, I'll have that up one more time. And that's just an opportunity for you, if you'd like to schedule that initial Zoom chat with us, bring along any and all questions that you've got. You can go to schneiderlasik.com, call us directly right there as well. And really, we just want to take a moment and thank all of you. There's an exceptional sort of crowd here today answering all questions. We will provide you with a link to watch the recording of the webinar should you have any remaining questions. But the next step for all of you is to schedule that complimentary that Zoom chat. Do it at schneiderlasik.com. And we're also going to follow up with you. You may receive a call from our team to kind of just give you that warm thank you for joining, and also see if you have any questions. So Dr. Sam and Dr. Schneider, I want to give you a chance to kind of say any final words to people on the webinar, please.
Well, I'd like to say thank you for taking the time to attend the webinar. I think the first step is education, and that's really our goal. I mean, I think if we feel like we've educated you about the eye and the options that are out there, then we've done our job. So again, thanks for joining us today. Dr.
Sam?
Yeah, thank you so much for spending your lunch hour with us. I really appreciate it. I hope we'll see some of you in the office soon.
Actually, I do have one last question, and I apologize for failing to actually mention this. Where are we located, and where can somebody, once they have their initial consultation, where are we located to be able to help them with their procedure and pre and post care and all that stuff? Dr. Schneider?
So we have 3 different locations, Corona, Riverside, and Rancho Cucamonga.
Wonderful. Okay. Again, if you have any questions about whether or not you are a candidate, or if your age is in the right range to have it done, or all that stuff, and just want to learn a little bit more, go to schneiderlasik.com and schedule that free Zoom chat with us. Again, it's a chance for us to connect with you, have a real human-to-human conversation. We understand that your time is precious, so we want to make sure that we're giving you all the answers that you need. So on behalf of all of us here at Schneider LASIK, have a glorious rest of your day. Thank you for your attention and for your time, and we look forward to connecting with you. Take care, everybody.
Thank you.
Bye.
Bye.
Bye.